wherever you're coming from, whether it's from a Southend organisation or from outside the city, I hope what follows will be thought-provoking as we go into a new future for early years in relation to Best Start in Life and associated initiatives. So, with that said, I'm going to hand over, I think, to Nia Thomas as Director of A Better Start Southend.
Good morning, everybody. As I think Claire has already said, my internet is a little bit unstable this morning. Of course it is, the most important day. But a very big welcome to everybody who's joined us this morning. As Alex has said, I'm Nia Thomas. I'm the Director of A Better Start Southend. And I'm absolutely delighted to launch our Stories of Impact reports that bring together the outcomes, outputs, data analysis and evaluation from the 10 years of the A Better Start Southend programme. As part of our Stories of Impact, we're going to be sharing with you what we've learned about the needs of babies, children and families. We'll share with you what we've discovered about delivering services in collaboration with partners and the importance of co-producing those services with parents. We'll share with you what we've discovered about delivering a programme of this scale and duration through our experiences of partnership working, change and adaptation. In total, there are 9 stories of impact reports that explore infant feeding, confidence, the journey through COVID-19 and more. And in looking forward to Beyond a Better Start, we're going to share with you 4 recommendations that that revolve around trusting relationships, adaptability in the face of complexity, the importance of including everyone and starting with the end in mind. And these recommendations, they're really going to be key considerations for you as you move forward in implementing giving every child the best start in life, which is the government's new early years and school readiness strategy, and Fit for the Future, which is the NHS's new 10-year plan for England. A very big thank you to our research partners at the University of Essex and RSN Consulting, and my biggest thank you to the A Better Start Southend Research Evaluation and Impact team for producing these stories of impact, which I think are really essential reading and learning for everyone involved in delivering effective intervention in the early years, but for the next 10 years and beyond. So without further ado, I'm going to hand over to Dr. Claire Littleford, who is going to talk you through the stories of impact.
Thanks very much, Nia. Yes, as Nia just said, excuse me, my name's Claire Littleford. I am Head of Research Evaluation and Impact here at A Better Start Southend, and I'm really delighted to be able to present this work to you. This is kind of the culmination of all of the learning that we've developed over the last few years at A Better Start, and it's really bringing together what we think are the kind of insights and learning that have come out of all of the activities, all of the different projects and services, the evaluations, the different pieces of research and so on that have taken place over the last few years. So I'm going to just introduce this section, and then my colleagues in the Research Evaluation and Impact team are going to take sections each. So I'll be followed by Mickey Barrett, Beth Buzzer and Nathaniel Owen. So we go on to the first slide, please, Roger. Thanks. So just a refresher for people who are less familiar with A Better Start. So this is a 10-year test and learn programme that's been introduced across the country, funded by the National Lottery Community Fund, with the aim really of supporting early years children and families to have the best outcomes in life. Focusing on 3 workstream areas: diet and nutrition, social and emotional development, and communication and language. But in Southend, we also focused on 2 kind of cross-cutting areas, which were community resilience and systems change, really to help us understand how we could really implement all the differences that would make the changes for families in those areas. So in Southend, we had £36.9 million over the last 10 years. And we've been working primarily in 6 ABSS wards: Kersal, Milton, Shoeburyness, Victoria, Westborough and West Shoebury, which are really the areas that when ABSS was set up in 2015 looked to be the areas that would most benefit from the really intensive support from ABSS. And then the rest of the city has benefited from the learning that we've developed in those areas. And our aim has been to make Southend-on-Sea the best place in the country to bring up a child and be a parent. And we really think that we have made a real difference in Southend. Yes, next slide, please, Roger. Thanks. So the stories of impact reports, as Nia mentioned, cover a variety of different themes. So we've got the 9 key reports that are listed here, which we'll be talking through today. We also have our A Better Start Southend website, which has been redeveloped from the website that was in operation while the programme was running, and now contains lots of really useful and interesting and insightful information about the programme, the impact we've had, and the learning that's developed from that. So we have all of these stories of impact reports are on the website, alongside different resources. We've got vlogs and videos with people talking about their experiences. We've got a whole wealth of family resources that have been developed. It's a really fantastic set of resources, which can be used by families or by practitioners working with early years children and families, and really gives some fantastic resources that can be used there. And we've got details of all of the projects and services that came through ABSS and reports from publications, so our formal evaluation reports. And you can also link to the local services map, which is hosted by the City Family Community Interest Company, and really gives an idea of the access that people can have to services now and what support is out there for families now. So if we could go to the next slide, please. Thank you. So just some quick context to ABSS and the context that we've been working in over the last 10 years. So we know that many children in Southend face high levels of deprivation, with around 75% of our ABSS beneficiaries actually living in areas that have 30% highest deprivation nationally. So we know that there are real challenges that are being faced by families in Southend. We know that deprivation and the wider determinants of health, things like housing, education, employment, and environmental aspects, really impact on child development and can actually set the course of a child's life. So it's really, really important that we're able to intervene early to make differences in families' experiences. We know that the COVID-19 pandemic and also the ongoing cost of living crisis has added strain for families in Southend. But we also know that there's fantastic opportunities in Southend with really strong communities, strong organisations that are out there working with families, fantastic peer support and informal networks of support. And all of this gave ABSS an opportunity to work in partnership with families to change lives. So I'm going to hand over to my colleague Mickey now, who's going to talk about the first of our stories of impact reports. Thanks. Mickey, you're on mute.
Knew that would happen. Hello, I'm Mickey Barrett and I'm the Research Evaluation and Impact Officer at A Better Start Southend. And the first report that I would like to talk to you about looks at the supporting infant feeding. So this report explored how ABSS supported breastfeeding through a systems change lens. And it showed that taking a person-centred approach and building those trusting relationships helped to increase parental confidence. At the same time, systems level changes such as joined up services and clear referral pathways and dedicated strategic roles made it easier for families to access the right support when they needed it. Peer support networks were also a key part of this ecosystem, as they not only promoted breastfeeding, but they strengthened community resilience, which is a theme that kind of runs throughout all of the papers presented. Ultimately, the report highlighted that for breastfeeding to be truly supported, we needed a wider cultural shift, and which is something that needs to be more normalised and visible across society. And this kind of change requires coordinated efforts across services, so and communities and public spaces. As you can see from the graph shown on the slide, the ABSS areas which are in green saw a more variation over time with reference to the increase in breastfeeding at 6 to 8 weeks. and the rates increased in 2020 to 2021, but then obviously dipped in 21-22 before rising again, and this could be through the impact of COVID. It's important to note that by 24-25, the gap between ABSS and non-ABSS had narrowed significantly, which may suggest that recent interventions, particularly in ABSS wards, may have had a positive impact. Next slide, please. So the second report I'd like to discuss is looking at From Birth to School, which focuses on how ABSS supported children's social and emotional and communication development in Southend, specifically in those early years leading up to the first year of primary school. So one of the most significant outcomes was a reduction in the need for intensive clinical speech and language support, which was made possible by early community-based interventions that kind of focused on prevention rather than a crisis response. ABSS also worked to increase collaboration between services, which meant that families received more tailored and joined up support, which effectively then helped children transition into school more smoothly. And the type of multi-agency work presented here is a great example of systems change in action, which looked at breaking down silos and shifting how services work together for better outcomes. A key part of the success was building parents and carers' knowledge and confidence, and through programmes mentioned in this report, such as Let's Talk and Story Sacks, families were empowered to support their children's development in everyday settings. So something that they learned within their attendance at projects was then continued at home. Importantly, as you can see from the graph there, we also saw a reduction in the development gap between children in ABSS wards and non-ABSS wards. So the graph shown on the slide looks at children's measurement for a good level of development, and specifically in areas such as literacy, communication, and personal, social, and emotional development. And that gap has actually narrowed between ABSS and non-ABSS. However, we don't have data before 2022 because the good level of development measurement was just slightly different before that. The one thing I will say is that the stories presented here bring impact to life. And as you can see from the quote being presented on the slide, it looks at individual transformations which kind of reflect the wider systems and community changes that ABSS has been working towards for the last 10 years. Next slide, please. So parental resilience. So this paper is quite unique because it brings a lot of projects together from completely different strands, with the main overarching theme being parental resilience by addressing sort of mental health, strengthening peer networks, and also empowering families. And at the core of this work was a holistic strength-based approach. So that means rather than focusing only on the problems, services supported parents by recognising their existing strengths and building upon them. And this approach helped to meet a full spectrum of family needs, such as emotional, social, and practical. Within this report, ABSS offered a range of integrated support, and that really ranged from perinatal mental health and peer support networks right through to programmes such as Your Family and Families Growing Together. But what draws all these projects together as one means that they were tailored and non-judgmental and accessible to families, which really helped parents and carers feel more confident and connected, not only to each other, but to their community. A key part of their success was creating safe and supportive environments where peer networks could really flourish, and parents weren't just receiving support, they were building resilience together by sharing experiences and helping one another feel less alone, which was specifically important straight after COVID. And this kind of approach, I suppose, also supports sustainable systems change, which effectively enables families to make lasting improvements in their well-being rather than depending on crisis intervention, and looks at more of those kind of long-lasting forms of impact. Just with reference to impact, parents and carers were really reflective on how they felt calmer and more capable to deal with challenges that they faced, as you can tell by the quote on this slide, and a lot more of those quotes are fed within the paper. Next slide, please. So we'd like to show you a vlog which really demonstrates the impact that ABSS has had on parents and carers within the community. So feel free to watch.
My name's Abby Rex. I'm the Children, Youth and Families Manager at TrustLinks. TrustLinks is a local independent mental health charity, so we support families and adults across Mid and South Essex.
Got moved here just over 3 years ago, so I didn't know anyone in the area. So I've come here, I've built up that group of mum friends, and yeah, just a great support network. I think being outside in nature is so important for young children. I think it's good for them to get their hands dirty, it's good for them to get stung by stinging nettles and smell the different kinds of herbs, and really good for their development.
From families growing together, I think parents get the support from one another. I think that is kind of a really huge part of what it does. It is a family. People who would never have come across one another in their day-to-day life have the opportunity to come in and explore and gain advice from one another, and understand that actually parenthood can be really tricky and they're not the only ones going through it.
I live in a flat, have no balcony, so this is just perfect for my kids. I come here to relax. I know that it's a safe space for my children to run around. I know they're not going to escape. I can chill out, talk to other mums, and I've just got nothing but good stuff to say about this place.
It's good for a dad. There's no judgment. So when you come, everyone's just exactly the same with you, whether you're a mum or a dad. You feel as if you can relax a bit as well. As soon as you get in, the staff, "Oh, you a cup of tea?" "Yeah, no worries," and get your tea and biscuits, and kind of have that kind of chance to chat with other adults. I'd say it's been great for us, kind of, because families growing together. Our family has grown together with the people here.
It is fantastic. I love this place. I can't express how good it is. I can't, no words. Just.
Thanks, Roger. And just to let you know that all of the vlogs are available on our website. They're absolutely beautiful, so feel free to go and have a look. And before I move over to my colleague Beth, I'll just discuss the last report that I have. Just wait for the presentation. Thank you. And the last report that I would like to draw to your attention before I pass over is looking at family voices, and this kind of highlighted how ABSS put the voices of parents and carers, and also children as well, at the centre of its work. Effectively, they weren't just being treated as participants, but they were true partners in shaping services and systems. And the thought process behind this was kind of by treating families as equals in co-production, ABSS was able to develop support that was more relevant and more effective and better rooted in the real experiences of the community. Just again, moving it over to that systems change, it contributed to this on a broader level, which helped to shift the culture of service provision towards one of shared ownership and really focused on long-term impact that was beyond the programme. A key part of this approach was funding and supporting grassroots projects. So within the report, there's a section that talks about SID funds and how they were created and why they were created. And the locally driven initiatives proved to be more adaptable and sustainable, as well as impactful. Also within this report, there are two research projects conducted in-house from the Research Evaluation and Impact team, which use participatory frameworks, so really put the participants as the leaders of the research. And one of these was led by Parent Champions, which looked at exploring potential barriers that they may have faced when accessing service, but also offered a space for reflection and for them to realise how invaluable they've been to the service. And the other engaged children directly, so looking at children aged 0 to 3, 0 to 4, and giving them a voice in shaping the support that they may need in the future, more of acting as a blueprint to hand over to other projects. And the full reports for them can be found on the website. But these projects not only generated valuable insights, but also built capacity and confidence within the community. And I'll hand over to my colleague Beth.
Morning everyone, I'm Beth Buzzer. I'm the Research Evaluation Impact Lead here at Better Start Southend. So as we've seen, ABSS is a complex programme which has involved multiple organisations addressing a range of different priorities over this 10-year period. The data we presented over the past few slides has focused on evidence and insights from parents, carers and practitioners. On this slide, we're going to be looking at experience and insights from the core programme team who are coordinating and managing the ABSS programme for evidence that could be useful for others planning or delivering similarly complex programmes in the future. And the research team at ABSS conducted interviews and also used a participatory evaluation method called ripple effects mapping with current and former ABSS staff and governance members to gather their reflections on how ABSS operated. The ripple effects mapping, which has been shown in this little graphic on the right here, identifies the following distinct periods in the development of ABSS. Firstly, we have the launch, which saw a period of idealistic enthusiasm, followed by formation and frustration, where infrastructure needs became a challenge. The pause gave a period for reflection and regrouping, followed by the relaunch, which saw new leadership and introduced disruptors which challenged previous ways of working. The pandemic response required flexibility and adaptability to become key, followed by a period of consolidation and growth, where relationships are rebuilt and services strengthened following the pandemic. Finally, we moved on to a period of legacy, sustainability and learning, where we're taking forward the insights from ABSS programme into the future. As a result of this research, we found the following key piece of information. Firstly, change, challenge and disruption shouldn't be seen as bugs, but as features of a complex programme formed of many parts and shaped by different influences. Moments of disruption can provide opportunity to innovate and reshape service delivery. Working in partnerships mean working with partners who themselves face change and challenge, and they may be affected differently by outside circumstances. Effective relationships are at the heart of both partnership working and organisations with co-production with communities. Trust is critical, but it takes time and space to develop this. Successful change occurs when you have a foundation of trust. Innovation and identifying what works and building effective partnerships and services takes time and space, and it's better to do less and do it well than it is to rush ahead before a partnership, organisation or idea is ready. We found that locally developed services tend to work better than generic programmes because they reflect the local experiences and circumstances. And finally, evidence is key. From underpinning new ideas or services to identifying progress to finding the impact of a programme, robust data and evidence is needed at every stage. Data needs to be collected consistently, with what will be reported at the end guiding what to collect from the start. The next slide, please. So thinking now about the impact of COVID-19, we've obviously seen that the pandemic profoundly affected our families, children's development and social care services, with the greatest impact on populations living in the highest deprivation. Children living in these communities faced additional challenges, including limited access to digital learning resources, reduced socialisation opportunities and increased family stress, and that contributed to widening developmental inequalities compared to less deprived peers. We take a look at the two charts on the right. You can see there are key inflection points relating to the pandemic. If you look at the top chart, you can see developmental progress of ABSS children, which is seen in green, has been on a downward trajectory since 2020-2021 at the time of the pandemic. And the bottom chart, you can see there's an outsized spike in the prevalence of overweight children entering reception in ABSS wards in 2020-21 versus non-ABSS and national cohorts. The flexible design of ABSS services allowed for rapid adaptation, enabling services to pivot quickly to meet evolving family needs at this time. Strong multi-agency and cross-organisational working underpinned the ABSS response to the pandemic. Again, the trusting relationships, shared goals and reduced bureaucracy enabled coordinated support for families during a time of national uncertainty. Families in ABSS wards experienced heightened vulnerability during the COVID-19 pandemic, but consistent, trusted staff remained available for support, unlike areas where key personnel were redeployed. this continued engagement offered some protection from the worst impacts of the pandemic and has proven important as COVID-19's long-term effects on deprived cohorts become clearer. Move on to the next slide, please. So thinking about ABSS as part of its system, we found that creating effective and long-lasting change in systems requires organisations and services to work in partnership alongside the communities and families they serve. Ownership of systems change needs to be shared, with collaboration, co-production and distribution of leadership taking place at all levels and across organisations and stakeholders. The ABSS programme created an ecosystem of support for families based along a shared ethos of partnership working that built connections between organisations and put family voices at the centre of service design and delivery. This ethos shaped the changes that ABSS made, from systems level integration of services and the adoption of co-production through to services' common focus on relationship building, improving soft skills that support hard outcomes and continual improvement of services. The service map that you can see on the right here demonstrates all the services that ABSS links into and the relationships that ABSS has facilitated between statutory, professional and community partners. These relationships improve efficiency of referrals, inter-organisational communication and the family experience. Also improves the working experience of practitioners. One cited the quote at the bottom here: "The value that's added is more than the sum of the parts because we're able to work together." And this demonstrates the power of strong relationships and communication. Our evaluation demonstrated how ABSS addressed 5 domains of systems change: shifting resources towards prevention, upskilling the workforce and sharing learning, integration across sectors, parent and community-led services, and putting the family at the centre of services. The key insights from the programme concluded that understanding partners' priorities is an important precursor to changing systems, but collaboration and integration at service level may still be possible and effective even when partners' priorities are not identical. Understanding and mapping needs, assets and services is vital to underpin systems change, but should be an ongoing process, regularly reviewed and renewed. Practical steps such as creating directory support can facilitate signposting of families and cross-referrals. Creating formal and informal opportunities for practitioners to share learning increases collaboration, cross-referrals and sharing of expertise and best practice. Understanding how families access services can surface opportunities for integration or collaboration, such as hosting partner organisations, sharing premises or cross-referring to services. And finally, a partnership approach can build relationships between organisations that make processes such as sharing data easier to put into place. Thank you. I'll pass on to my colleague Nathaniel.
Hello everyone, I'm Nathaniel Owen. I'm the Research Evaluation and Impact Assistant, and I'll be going through the recommendations section. So just to give you a general overview to what the recommendations section was, the ABSS Stories of Impact reports, all 9 of them, were codified and then analysed metathematically to establish areas of commonality, leading to the identification of these cross-cutting themes. These themes form the basis of our 4 key recommendations from the ABSS programme. This is the information we would like to impart on others who may be conducting a similarly complex project or programme for the future and serves as part of our legacy. So for the first one is trusting relationships and community-centred practice. So relational practice, co-production and peer support are the key to engagement, well-being and lasting community empowerment. So speaking to the first point, clinical practice might be useful in some respects, but often it's not what people want or need in certain cases. We look to create an environment of amicability and friendliness, focusing on the person, not the outcomes. We had a project with perinatal mental health, and one quote always stood out to me. And this is not verbatim, but it was along the lines of, "It felt like the only service where I was actually listened to and not just read to off a checklist." Speaking to the second point, programs co-produced with families and based on inclusive outreach are more trusted, better accessed and more sustainable. It equips parents to face further challenges down the road. To the third point, Food Club, which is one of our services, provided a space where parents can meet other organisations in an informal manner, raising awareness and increasing the likelihood that parents access a multitude of services. It's coming to where the parents are rather than making them come to you. It addresses the inherent power dynamics and aids accessibility. Can we move on to the next slide, please? So recommendation 2, which is the flexibility, responsiveness and adaptation in complex systems. This is ensuring system dynamism is essential for positive results. View disruptions as features of a system and not as a bug. So the first point, this is recognizing when services are not meeting demand or getting enough engagement, and understanding that a pivot may be required. This could be in recognizing that services may be too arduous or hands-on, and learning from it and implementing something more relaxed and less strenuous. Or it could be something different. So with the aforementioned food club, this was the result of the cost of living, whereas before the cost of living, we had lots of provisions for healthy eating, but this sort of became less relevant as the more pressing issue became of families being able to feed their children. But with the addition of wraparound supports, they could get further support from it. To the second point, this is recognizing when parents have time and adapting to this. So one of our aims that came out of evaluation done by RSM was that we weren't engaging fathers enough. So with that aim, we led to more weekend sessions or evening events, as a lot of the fathers still worked a traditional 9 to 5. To the third point, it's about promoting and not just allowing malleability in leadership, but also ensuring that others can work to the top of their job spec. And thinking in a more structural overview, ABSS had a program group, and this joined up leadership in the council, public health, amongst others. This allowed for cross-organisational consultation, collaboration and deliberation, in addition to offering guidance and potential course correction. Go to the next slide, please. So recommendation 3, this is inclusion, equity and reducing barriers. Services must be designed, developed and delivered with family voices at the centre and inclusion in mind to ensure equity of access to babies and families with the greatest challenges, with barriers minimised or knocked down. Some of these barriers that we may be talking about include stigma, time pressures, language differences and cultural disconnects, amongst others. So for the first point, an example could include story sacks. These are available at libraries with the aim of increasing instances of parents reading to their children in interactive and creative ways through the use of props. Story sacks are available in over 10 languages, which respect the right of parents and children from different communities to bond with their children in their native tongue. To the second point, there was the creation of a service directory for City Family, our legacy vehicle, which allowed individuals within the community to see what services are on offer. It also served as a dual function because it allows us to see what might be needed in the future and where demand is aggregated. And to the third point, I've previously mentioned this, but we had an independent evaluation of ABSS done by RSM, and this was using data dashboards created by Southend City Council. This allowed for an impartial look into our community engagement and offered areas for improvement, which we then strive to alleviate. We go on to the next slide, please. This is evidence, impact and sustainability. So robust evidence is critical to developing and sustaining effective early years services. Evidence must be embedded throughout the life cycle of programs, from design to delivery to evaluation. To the first point, ABSS identified different outcomes, frameworks and cross-cutting themes. Projects were commissioned or needs are identified with an aligned to these overall goals. These are briefly mentioned. These are social and emotional, communication and language, diet and nutrition, community resilience and systems change. Data and evidence allows you to discern whether you're making a tangible difference. So legacy vehicles such as City Family are pivotal in cementing the positive benefits the programme has had in the long term. City Family builds upon ABSS learning and iterates further for continued positive change. And to the last point, Parent champions enshrine peer support in the community and alleviate cycles of deprivation. Again, it's this recognition that parents are the vehicle for change. If we give them the tools they need, they can perpetuate positive benefits. And more anecdotal evidence from the university summary reports supports this notion, as informal circles and friendships continued after projects ceased. Go on to the final slide, please. I'd just like to thank you for listening to this webinar, and I think we've now got some space for questions, so ask away. I know it might be difficult because you're in a big group, but we're more than happy to answer any questions.
So let me go first. Alex Caldy here again. Please do put your hand up or come in or put something in the chat if you've got something to ask Beth, Nathaniel, Mickey, or Claire. This is a really helpful kind of resume of what we've learned over the years. The recommendations, I think, feel right. The ground level work that A Better Start was involved in seems to have been the real key to kind of managing improvement. The question arises for me about what we see as opportunities in the future to continue with some of the practice that you've spoken about. So Claire and the team, what are your hopes for what's emerging from the government's agenda? And what do you think in particular are the things that system partners will need to bear in mind when they're looking ahead at the next 10 years? And perhaps I can put that to Claire first in terms of that question. But yeah, I'm interested in, I suppose it's a build on the recommendations. What do you think organisations in Southend or indeed elsewhere will really need to make sure that they get right to create stories of impact over the next 10 years?
Yeah, thanks, Alex. I mean, I think the thing that first comes to mind for me is very much about that partnership approach, the partnership between organisations and looking for opportunities where they can add value to each other's work, and also the tie-ins that come across different organisations. And really, I think the value for that comes from how that then creates seamless systems of support for families. So it isn't the case that families have to learn how organisations work in order to be able to access services. It's that the services are designed with their needs right at the centre, so that it's sort of a smooth flow through and it's obvious where the support is. They're able to access things without having to overcome additional barriers. There's already enough barriers out there for people. What we need to be doing is actually removing those barriers. And I think one of the things that has made that possible, where it's worked well for ABSS, is where we've had those parent voices right at the centre, telling us what works, telling us, practical things that maybe, we in our kind of organisational settings don't think of, and they immediately say, well, actually, I don't know, we can't access that because there's no bus service there, or, we can't get the prams up the stairs, or whatever it is that is actually practical stuff. And I think the importance of the kind of networks that have built up is going to become more and more important as we see changes in kind of policy and the kind of environment that organisations are working in. I think there's opportunities for different organisations to come together and say, how can we address what's being said in the policy and actually make the most out of all of us working together? So I think those networks are vitally important. I know that City Family are hoping that there'll be continued networks for early years support continuing through Southend. So I hope that that will be, really, really effective, and they'll be able to develop some of the strong working relationships that have come through with the ABSS partnership. Don't know if somebody else wants to jump in.
That's really helpful, Claire. It is a dizzying, that system map that you showed us earlier is a dizzying set of connections, and it, we could probably make even more. And you're quite right. It takes somebody with lived experience to be able to point some of those things out. So that's really helpful. Thank you, Claire, for responding in that way. Nia.
I think a very similar thought to what Claire has shared. The government's new strategy, The Best Start in Life, it talks about early years and it talks about school readiness. And I guess one of my thoughts is, how do we ensure that we don't separate early years, which is often seen as a community, and one department looks after early years, and then you have another department that looks after education. As we've just talked about, we know that this ecosystem is really important. And as children move and transition through different services and different stages, that actually parents need that whole ecosystem to work together. We need the flows, we need those pathways. So what I really want to be able to share our knowledge to make sure that even though those strategies talk very clearly about different objectives, that actually those objectives aren't seen in isolation, that they are seen as a continuum of a child's life course through the early years. And I wonder if I might, whilst I've got the microphone, add in a question. Mickey mentioned that there were vlogs, and we saw that really heartwarming vlog from parents. What other resources might people find, whether it's website or YouTube or wherever it might be? What else is out there that people can access? Thank you.
Yeah, good question. Is that over to you, Mickey?
I guess so. So yeah, obviously we have the reports available, but so we have a YouTube channel that Roger's been helping us with, which has got a wide array of all of the things that we've put together over the 10 years. There's also lots of dedicated learning resource packs on the website, and there's a wide range of them. So anything to do with children with SEND, right through to breastfeeding tips. So it's all on the website, and also separate reports. So reports that the REI team have written in relation to the research projects that dealt with parent champions and children's research. So the good thing is that there's a wide range of mediums available. So if you wanted to watch a video or listen to anything, equally download any of the resource packs or read the papers. It's all available on the website. Hopefully I've answered that.
And just to add on as well, because I know Mickey is, I don't know, is quite self-conscious about these things, but there is a brilliant piece of research she's done as well with parent champions. So they did a storybook, and you can go onto the website, and there's a really wonderful extension which allows you to flip through these storybooks, so it actually feels like you are reading their stories. So I'd wish for you to go and look at that as well, and there's also the children's research as well. So we conducted this, and there is an interactive thing on the website where it's this mosaic of evidence, and it has observations, it has talking tins, you can listen to them. So I'd advise you go and look at that as well. But yeah, the website is brilliant.
Thanks, Nathaniel and Mickey. I'd like to extend that question a bit into organisations that are still operating in Southend, statutory and non-statutory, in a moment, but I can see Susan's hands up. So Susan, welcome, and ask away, sorry.
Hi everybody, thanks for being here really and celebrating A Better Start. I'm Sue Kalan, I'm the public health midwife. I work as part of Southend City Council and Southend Hospital, for those that don't know me. I'm in the process really, and I just wanted to just elaborate of making sure that the midwifery teams and the early years team in the council know of these directories and this information. I know it sounds a bit basic, but there are a lot of things that are out there that I've found as part of my role, down to my funding from A Better Start, that a lot of the NHS partners and even local authority partners don't know that actually exist. So I think it might be informative to us all, really, if I sort of try and see. With regards to information, is it is it open to the whole of Southend, or is it just the ABSS wards that we've concentrated on? Because obviously with what's going on in the local government at the moment with the reforms and devolution, obviously we're going to be expanding our areas. In what shape or form, I don't know yet, but we do need to be aware that Southend will grow and expand moving outwards. And obviously I'd like to be there to champion what we've got and our successes in Southend and how we can help our neighbours, really. So it's just to say, is this information sort of wider spread than just the ABSS walls, or is it just concentrated on that area? Thank you.
I think the answer is it is more widely available, but over to you, Claire.
Yeah, absolutely. It's the information, obviously the evidence comes from our work, which is primarily in the ABSS wards, but the information absolutely is, open to and relevant for anyone, really. I mean, we talk about Southend specifically, but most of our recommendations are relevant for other places around the country as well. For thinking about sort of national level responses as well as local level responses. So yeah, absolutely, we're really keen that our learning can actually get out there and really support people working in communities all over the place, really. I know that the changes in local government, which are imminent in Southend, are going to change the nature of Southend and the nature of the organisations and the way that services are provided in the area. But I think that all of our recommendations and all of our learning is really going to help with that. And certainly our learning around how to operate when things change, I think is going to really come into its own then, because I think there are opportunities to make some real differences in Southend once those changes come about. Absolutely. I'll hand over to Nia.
Just a thought, Sue, you may have access to different networks than we have access to, and you may be more interested in the perinatal mental health story of impact report or the breastfeeding. If you want to share any of those reports with your networks or do a newsletter soundbite, then we are more than happy to make sure that you have all of those links that are specific to that theme so that you can share.
That's lovely. Thank you very much, Nia.
Thanks, Sue. Thanks, Nia. Thanks, Claire. Michelle.
Hi, everyone. Fantastic presentation. Well done, everyone. It's been a pleasure working with you all over the years. I just wanted to say, for those who don't know, SEV still works on a Parent Voice project off the back of the work we did with Parent Champions. And we are still looking for opportunities where we can bring parents into that space so that their voices are part of your discussions and collaboration work in the future. So don't forget us, we are here, and I will pester people, but I'm just going to put, what I'm going to do is pop in the chat a link to the volunteer role, which is where we recruit parents. But remember, there's a second part of that where we're looking for opportunities to bring those parents into that space. So whether it's feedback or it's reworking something or it's a brand new thing, we're open to all sorts of things. So please do reach out.
I'm really glad you've said that, Michelle, because the world doesn't stop when A Better Start stops. We've already mentioned one or two things that are happening. City Family and its services and worth checking out its website are an important part of the creation of a long-lasting legacy in terms of organisational form. But that's not to diminish in any way the wider range of work that partners in Southend are carrying on with, whether it's through public health, who have really championed early years health and well-being as part of this programme and continuing, or what Michelle set out in terms of the work that SAVs are now developing, Trust Links in terms of their work that was showcased in this call, are continuing to try and find ways of offering services which are more parent and early years focused. We have the Healthy Start initiative that our partners in the NHS are leading, and obviously, as Nia mentioned earlier, the 10-year plan is now with us. And in saying all of that, I've probably missed 3 or 4 really important organisations in Southend that are carrying on with this early years work. Some of the challenge, I think, for the future is how does that all get linked up and built around the parent and the child, as opposed to being in the individual pieces. And again, I'm grateful to Michelle for mentioning the parent voice work that SAVs are doing, because that is one of the ways of more directly ensuring that some of that join up happens. So that was wonderful. Any further thought? I can see Abby's hand is up. Abby.
Hello. Yeah, I just wanted to obviously add off the back of that just a little bit more specific about what TrustLinks is up to. So we haven't actually been able to secure any additional funding at the moment. I think that's definitely one of the challenges that we're finding at the moment, is actually securing that resource to be able to run things. However, obviously we've tried to get a little bit more creative with it. Obviously part of the ABSS legacy funding, we myself and my team and a few others, we've all completed our level 3 forest school practitioner qualifications. So we started in June and kind of running all throughout the summer holidays. So we've got like a forest school nature drop-in sessions that we're running, and so that's for families with children aged 0 all the way through to 11. So we've got kind of an early years kind of nature top kind of activities, and then also we're expanding upon the cohorts that we were able to support kind of within the ABSS funding, and yeah, kind of really moving into that transitionary stuff into school. We're going to hopefully work closely with some home ed groups as well. So yeah, we've kind of broadened that offer. It's running on like a suggested donation basis. So we're paying, it's a pay what you can, a suggested donation of £5 per family. So hopefully it is as accessible as possible to a lot of the families that we've supported, and obviously tapping into a new cohort as well. So I just wanted to let everyone know that that's what we're up to. So yeah, every Monday at our Shoebury site and every Friday at our Westcliff site, which is the same as what our Families Growing Together project was running. So hopefully it offers a little bit of consistency for families that did know us, and hopefully are still attending with us. But yeah, thank you. That was just a point I wanted to add on.
Lovely. Thank you, Abby. That is points really well made and really interesting to watch how that develops. Eleanor, please come in.
Hi, yeah, just that was lovely to hear about Abby, and just kind of following on from that as well, just to say that here at Southend YMCA we are still doing some breastfeeding support. We do have a group once a week at SAVs. We don't have any funding. We have applied for other funding. We'll continue to try to do this. Unfortunately, we've not had anything at all, despite, you know, and it is hard, isn't it? Because we've obviously all just watched that wonderful presentation saying what difference it had made, that the breastfeeding rates had gone up, and that people felt that really special sense of connection, you know, that's somewhere accessible, they felt listened to. And we really want to build on that good practice. I've completed my lactation consultant training, got the qualification. I was really grateful to have that funding to do that from Better Start. So that is that legacy, but I'm here and able to provide that level of support, and my colleague is doing the same course of study as well, which is fantastic. However, the thing is, what we want to do is be able to keep that place really, that and keep that kind of knowledge within that kind of, you know, within that voluntary sector, within the community, so that it is there, you know, as and when opportunities come up. It's just you know, is difficult because there isn't other funding, and at the moment, you know, it's just had a few hours from legacy funding until the end of July, which is obviously really soon, and YMCA is just like finding a, you know, can't find money forever for this, unfortunately, but we will continue to do what we can. So yeah, and try and kind of be that breastfeeding support presence in the community, because we know that we do make a difference, as the research shows.
Well, I think the points from Abby and Eleanor are really good to end on. We're out of time, I'm afraid, but what I think both of those points are saying is that these recommendations, they matter. It is not smooth sailing in the future. There are reasons to be optimistic and positive about what might be happening on a national basis and how that translates locally. There are reasons to be optimistic and positive about some of the legacy impact, but also in the early years, 'twas ever thus. The money is not always as available as needs be and is susceptible to cuts and other impacts. So, it will continue to be challenging to fund and to coalesce people around that agenda. But, such a positive and enriching area for us all to have been working in. And I'm, want to close by giving my thanks to Claire, Mickey, Nathaniel, and Beth, and of course Nia as director for such fantastic work. And you've really done us proud on closing well the work of A Better Start with really insightful, well-researched pieces of work that are even now, after doing this for many years as chair, are provoking new thoughts and new ideas in my mind, and that will be true for others as well. So almost on the stroke of 11 o'clock. Thank you all so much for attending. And, as Mickey was outlining, these resources are available on a variety of platforms, and please do get back to the team if you need or want anything over the course of the next week or so. But they are the last people standing in A Better Start, and as staff they will be leaving us very, very shortly. And I think whether it's in whatever way, our thanks, heartfelt thanks to them, and all the best with the next chapters that you're embarking on. So thanks everybody for coming. Really, really super presentations, and good discussion afterwards. And we will see each other again soon, I have no doubt. Cheerio, everybody.